5. I'm literally in my PJs. I'm so ready to go to sleep. Y'all see my eyes? They're red. I am tired. But my exam is tomorrow at 7:45 a.m. Actually, it's supposed to be 7:55. I don't know why my professor's talking about 7:45 when the class is not supposed to start till 7:55, but I digress. Anyways, so we're studying, well, I'm studying for psych, right? And I just made some practice questions using ChatGPT, which is like literally my favorite thing to do these days when I'm studying. Um, so I'm just gonna be like working through those practice questions. I also do have like index cards, but I'm pretty good on these. Might run through them like one more time after I do the practice questions, just because like there were a few that was still like iffy on, but for the most part, pretty good on these. But yeah, look at the practice questions. So with the practice questions, I usually like to give myself like a lot. So I try to go anywhere from like 50 to like 70 questions to do, because I feel like the more questions I do, like the type of questions you see usually are repeating, and it gives you a good idea of like which concepts you really need to know. So I did 50. Like I might do more if it's not like super late by the time I get done with this. I want to be in bed or getting ready to like sleep by 9:30 so I can be asleep at 10 because I want to get my full sleep. I want to get my full night's rest. Okay, so I wish I could like show the questions on the screen while I'm doing them, but I can't. So I'm just gonna read. Okay. A nurse is caring for a client who has been diagnosed with post traumatic stress disorder, so PTSD. Which of the following interventions should the nurse prioritize to support the client's recovery? So, key things that I would know already is like the patient has PTSD. It's asking us about intervention. So, something that the nurse is going to do. So, it's a nurse action. And to prioritize to support the client's recovery, right? So, what is the most important thing that the nurse can do for this patient who has PTSD to help them recover? So, the first option, encourage the client to discuss the traumatic event in detail. Does that sound therapeutic? I'm going to tell the person who has PTSD to explain, to discuss what happened to them in detail. Does that sound like something that you want to do? No. So, we're going to cross that out. Provide a safe environment for the client to express feelings of fear. Okay, that's important. I don't think that's the priority. Remind the client frequently that the trauma is in the past and cannot hurt them. Okay. And discourage the client from avoiding reminders of the trauma. All right. So I think 4 already is a bad answer, like, because we're discouraging the client from avoiding reminders of the trauma. We don't want to like re-traumatize our patient, and in the fact that they're like still recovering from it, like we're not going to try and push them to like go back to what's traumatic to them, so that will be wrong. um I will go with C. Remind the client frequently that the traumas in the past and cannot hurt them. Like I feel like this is like really helping to orient the patient, the client, to like what's reality, and reminding them you are safe. The situation that happened is already happened. Like, you know. The other one is provide a safe environment for the client to express feelings of fear. I think that's also important, but I don't think that is like the most like important thing, or like that's the best thing that I can do to help my patient like recover. Mm. So I'm gonna go with C. I could be wrong. We'll see at the end. A child diagnosed with, so the topics that I'm studying actually, because I don't think I mentioned it, where I'm doing anger, abuse, anger, aggression, violence, OCD. Hi, Dylan. Trauma and stress related disorder, so like the PTSD, hostility, childhood disruptive disorders, childhood neurodevelopmental disorders. So that's like all the topics that's going to be covered on my exam. So that's why I'm like questions I'm looking at. So this one is a child diagnosed with ADHD is being treated with methylphenidate. So methylphenidate, I already am going to underline the drug because I know what that is. It's a type of stimulant. Which of the following adverse effects should the nurse monitor for during the initial phase of medication therapy? So, and it's a select all that applies. So methylphenidate is a stimulant. My stimulants, the side effects are, it's going to increase heart rate, it's going to decrease the appetite, like anorexia, like not eating enough. It's not anorexia nervosa, like the eating disorder, but like anorexia just means like little eating, you're not eating a lot. So that it also can stunt their growth, and it causes insomnia. So I know that. So I said those things so I know it, right? So I'm going to look which ones I see in the answer now. I see insomnia, yes. Increased appetite, no. It causes a decrease in appetite. So I'm going to write that on the side. Headaches, no. That's not a common thing. Weight loss, yes, because of the decrease in appetite, right? And the anorexia. And hypertension. That one, because it does increase the heart rate, but I don't think hypertension is necessarily a thing that's associated. I think it's just an increase in heart rate. With hypertension now is a elevated blood pressure. So yes, increased heart rate can maybe increase my BP, but like it's not always. So I'm not gonna put hypertension. I'm gonna put my insomnia and weight loss because I know those were 100% sure. We'll see if it says the hypertension too, and look at the rationale. So next question. A nurse is caring for a client with a history of domestic violence. Okay. The nurse is helping the client develop a safety plan. Important. Which of the following statement by the client indicates a need for further teaching? So when I see further teaching, it's telling me which answer is wrong. What is the thing that my client is thinking that is actually wrong? So there's going to be like 3 right answers and 1 wrong answer. So find the one that does not belong, right? So I will have a packed bag with essentials such as clothing and medication. If I'm trying to leave, that is a smart idea, right? I should have my things prepared. I will establish a code word that my children can use to signal danger. This is a safety plan. Of course, we want them to be able to let us know when they're in danger. I will leave when the violence occur to ensure my safety. I don't know, like you shouldn't leave when the violence occurs, you should leave before it occur, right? So I'm gonna like put a little thing there to see like that one I think might be the answer. I will memorize important phone numbers in case I need to call for help. Yes, that's something you should definitely do. So I cross out everything else so sees my answer. Because I will leave when the violence occur to ensure my safety. You want to leave before the violence occurred to ensure your safety. You're obviously not safe if the violence already occurred. And if we're making a safety plan, why would you leave after the violence? Right? Okay. A client with OCD engages in ritualistic hand washing for over 2 hours each day. The nurse should assess the client for which of the following complications: social isolation, impaired mobility, risk for self-harm, or impaired nutrition. The client is washing their hands routinely, like for a long time. I don't think we're really at a risk for impaired mobility. It says nothing about movement. We're not at a risk for self-harm. They're washing their hands. Impaired nutrition, again, like what does that have to do with anything? I would say social isolation because they're spending so much time on this. Like, at what point are you around other people? Like, they already, in a sense, are excluding themselves, and other people might isolate them as a result. Hi there. Hello, hello. So, yeah, I'm just doing some like practice questions for my psych exam tomorrow. Like, if you are interested, you're in nursing school or whatever, this could be helpful. But yeah, so I'm just reading the questions as I'm going through them with like my rationale. I could be wrong, obvi, but I do have the answers at the end that I'm gonna look at to just see what I got right, what I got wrong. A nurse is assessing a child with oppositional defiant disorder. Which of the following behaviors should the nurse expect to find? Okay, so they have oppositional defiant disorder, excessive energy and hyperactivity. No, because that would be ADHD. Blaming others for mistakes. Not really seen with opposition defiant. Inability to follow directions. Hello, hello, hi there. I would say yes, because they're defiant. Being defiant means you don't want to listen to others. So yeah, you don't, especially like authoritative figures. Hi there, Samantha. Um, Persistent temper tantrums. No, you're not really gonna see that. Inability to concentrate. Again, that's more ADHD. So that leaves me with C. Um, yeah, so I'm just answering some questions for us, doing practice questions for my psych exam. Like, that's why it's like a study session. So I'm just going through the practice questions. And I like doing this just because, like, I need to actually do this. I need to do this. Yeah. So there's a lot of topics that's on my exam. So it's like childhood developmental disorders and disruptive disorders, abuse, violence, aggression, OCD, PTSD, and other stress related disorders. So yep. So like this one, the next question is a stress related. A nurse is caring for a client with acute stress disorder following a car accident. The client reports intrusive memories and nightmares. Which of the following is the most appropriate initial intervention? Encourage the client to avoid talking about the trauma. Teach relaxation techniques to reduce anxiety. Provide a quiet, calm environment to minimize stimuli. Administer benzodiazepines as prescribed. So this one, no, this is for school. Like I'm in nursing school, so yeah. I wish this was for a job. I want to say I'm stuck between like B and C for this one, like teach relaxation techniques to reduce anxiety, or I'm going to also pick C because I feel like if they're struggling like with the intrusive memories and nightmares, like you want them to be able to sleep, and having a quiet, calm environment will really help with the sleeping. But I'm like also teaching relaxation techniques might be also beneficial. But I'm gonna go with C. Okay. A nurse is educating a parent of a client with autism spectrum disorder. So autistic about behavioral intervention. Which of the following strategies should the nurse recommend? Reinforce positive behavior immediately. Yes. Establish a consistent routine for daily activities. Yes. Provide verbal praise for appropriate behavior. Yes. Increase sensory stimuli to engage the child. I'm gonna say no because sometimes with children and just anyone with who has autism, like too much stimuli can be it can like they can become overstimulated easily. Like they can either be like hypo or hyper when it comes to like stimulation. So you don't necessarily want to increase the stimuli. Use a reward system for desired behavior. Yes. And as someone who works with a kid who has autism, pretty much everything I said yes to is things that I do with that child. And, like reinforcing positive behaviors immediately. Like, tell them, yes, good job, or rewarding them, having a consistent routine. Those are things you do want to do with people who have autism because they tend to like routines and they like the structure and it helps them. So, yeah. I gotta spend some time. Hustle. Okay, which of the following statement by a client diagnosed with intermittent explosive disorder indicates a need for further teaching regarding anger management? So they have intermittent explosive disorder. We need to know what is the wrong thoughts they have about anger management. I plan to identify early warning signs that I'm becoming angry. Yes, we want them to do that, so no. I will learn techniques to calm down when I feel angry. I will allow myself to express my anger in any way I feel is necessary. That is so wrong. Like, I already know that's the wrong choice, right? Because no, the point of anger management is to appropriately deal with your anger. Like, not any way I feel necessary. Like, no. A nurse is assessing a child who exhibits behaviors such as aggression and defiance towards authority figures, along with a lack of empathy. The nurse expects the child might have conduct disorder. Which of the following behaviors are consistent with this diagnosis? Select all that apply. Destroying property, yes. Engaging in theft or lying, yes. Frequent temper tantrum, not necessarily. Bullies or intimidate others, yes. And lack of remorse after misbehavior, yes. A nurse is providing discharge teaching for a client with OCD. Which of the following intervention is most appropriate? Encourage the client to stop engaging in compulsory behavior immediately. No, because the compulsions are not um controllable by the patient. Teach the client to gradually reduce the time spent on compulsion. Yes. Recommend the client avoid talking about the obsessional thoughts. No. Advise the client to engage in compulsive behaviors only in private. No. So the only correct answer is option B. Teach the client to gradually reduce the time spent on compulsion. So this is also known as response prevention. Right? Yeah. Yep. Okay. Which of the following nursing interventions are appropriate when managing a client with a history of anger and aggression? Select all that applies. Set clear, consistent boundaries. Yes. Encourage the client to suppress their feelings of anger. No, we never do that. Provide positive reinforcement for non-aggressive behaviors. Offer opportunities for physical exercise or activity. Yes. Avoid confrontation during moments of heightened aggression. That's an interesting one. Yes. Yeah. Okay. A nurse is educating a group of parents about signs of childhood trauma. Which of the following should be included in the teaching section? Select all that apply. Aggressive behavior, nightmares or sleep disturbances, difficulty concentrating at school, increased dependence on parents, withdrawal from peers and family. So with trauma, you will see the sleep disturbances. You can have like nightmares. You wouldn't really see aggressive behavior. You would not really see an increased dependence. They can become isolative, so like where they're withdrawing from other people. Which of the following are common triggers for violent outbursts in a client with borderline personality disorder? I don't know why this one's on here because I'm not talking about borderline. Perceived abandonment, yes. Fear of intimacy, no. Disruption of routine, criticism or rejection, yes. Um, a nurse is caring for a client diagnosed with reactive attachment disorder. Which of the following interventions should the nurse prioritize? Encourage the child to form close relationship with peers. Teach the child to recognize and label emotions. Establish trust through constant caregiving. Promote independence by allowing the child to make decisions. The hard one. I would say I'm gonna go with B. But I feel like this is also not something I'm really being tested on anyway, so interesting. A nurse is caring for a client who is experiencing a panic attack. Some of these are definitely not questions that I'm gonna be asked, so I'm like, I kind of want to skip them, but yeah, I'm gonna skip that one because I'm not gonna get asked it. We're not doing anxiety and panic attacks anymore. We did that already. A nurse is caring for a client diagnosed with ADHD. Which of the following behavior will be considered characteristic of ADHD? Difficulty remaining seated in class, tendency to ignore rules and boundaries, limited interest in social interactions, engaging in repetitive behavior. So it's going to be A for sure. Difficulty remaining seated in class because of that hyperactivity. Yeah. Nurse is caring for a child with autism spectrum disorder who has difficulty communicating verbally. Which of the following intervention should the nurse recommend to improve communication skills? Use simple, clear instructions. Allow the child to choose activity independently. Avoid using visual aids or gestures. Encourage group discussions to foster socialization. I would say D because I feel like A is like if they're having an issue with like following directions or instructions. B is like lack of independence. C is like teaching them. Like you wouldn't want to avoid visual aids and gestures. You actually want to do that if they have issues with communicating. But like the group discussions will help them to like talk more. Yeah. Which of the following behaviors should the nurse expect from a child diagnosed with conduct disorder? Excessive shyness and social withdrawal? No. Displaying cruelty to animals or people? Yeah. Yeah. A nurse is assessing a client with OCD. Which of the following statements should the nurse expect the client to make? OCD. I have thoughts that something terrible will happen if I don't perform certain rituals. I feel I need to keep everything in perfect order or it causes me distress. I can't stop checking if the doors are locked, but I know it's not necessary. I have to wash my hands repeatedly because they feel dirty. I will go with B. A child with oppositional defiant disorder is referred to therapy. Which of the following therapeutic approaches is most appropriate? So they have oppositional defiant disorder. We're trying to figure out what is the best thing to do for this child. What's the most therapeutic? Parent, child interaction therapy, cognitive behavioral therapy, medication management for anger control, or play therapy. I want to go with A, parent child interaction, because this is a child who is defiant. They're not respectful and they don't listen to authoritative figures, so you want to help how they interact with their parent. Or maybe CBT, but I feel like it's not CBT, but whatever. A client diagnosed with intermittent explosive disorder asks for advice on how to control outbursts of rage. The nurse teaches the client which of the following techniques to help manage anger: counting to 10 slowly, walking away from situations that provoke anger, deep breathing exercises, using physical violence to release anger, identifying early warning signs of anger. I'm going to go with all of them except for D because using physical aggression, physical violence can also cause you to become more aggressive, so you don't necessarily want to do that. A child with ADHD is referred for behavioral therapy. Which of the following intervention should the therapist prioritize? So they have ADHD. Increase the child's physical activity to improve focus. No, they're just going to fatigue them. Teach the child self regulation and coping skills. Encourage the child to spend more time alone to improve concentration. Use medication to enhance cognitive function. I'm going to go with C. A nurse is assessing a client who has been diagnosed with generalized anxiety disorder following a traumatic event. Which of the following is the most common symptom of GAD? Oh, constant worrying. Okay, a nurse is caring for a client diagnosed with antisocial personality disorder. Again, not going to be tested on this. Which of the following behaviors should the nurse expect to observe? Repeated violation of the rights of others, high level of empathy, nope. A fear of being abandoned by others, nope. That's borderline. A tendency to avoid risky situation, nope. Is A. Okay, halfway through. Thank the Lord. A nurse is developing a care plan for a client diagnosed with major depressive disorder. Again, what the heck? Not being asked that. Okay, so I have the answers for the first couple questions I did, so I'm just gonna go through, see what I got correct, what I got wrong. Okay, so let's see. Number one. Okay, so number one I got wrong. Scandalous. So I'm going to change the color. So number one is B. I put C. It says provide a safe environment for the client to express feelings of fear. Okay, and I said, okay, okay. Let's move on to number two, which was a select all apply. So I had A, which is correct. C, it did say hypertension, and the headaches can also be associated with stimulants, which is interesting because my professor did not go over those two with the medication. So that's interesting to know that the methylphenidate can cause hypertension and headaches. But interesting. Okay, number three. Three I got correct. Three is in fact C. I will leave when the violence occurred to ensure my safety. Leaving during an episode of violence can put the client at greater risk. Safety planning involves preparedness and anticipating danger before it escalates. So right. Now we're gonna do number four. Number four was A, social isolation. Excessive hand washing can lead to social isolation due to embarrassment or time consuming rituals, which interferes with the relationship and daily activity. Okay. Was this a select all that apply? But it doesn't say it. So it looks like five was a select all that apply, but it did not state that clearly. So it's saying the answers are B, C, and D, which makes sense. But if I was just reading this as to choose one, I would have said C is the best answer. Yeah. Because I hate when it does that. Like, that's the thing. Sometimes ChatGPT be like messing with me with that, like where it's a select all apply, but it doesn't state that it's a select all that apply, and then I just pick one answer. Like, come on now, get it together. Okay, and six is it's six is B, and I put C. It says in relaxation techniques are great for the intrusive memories and thoughts. Okay. Number seven now. A, B, C, and E. So, yep, seven I got correct. Yeah. Eight I also got correct. Nine, let's see, A, B, D, and E. Yep, I got that correct as well. How about 10? I got 10 correct. 11, A, C, D, and E. Yep, got all those correct. Number 12. Okay. It's also saying A, but like I didn't pick A, but I picked everything else. I'm gonna just like, yep. Okay, 13. Which 13 is a question, like, we're not talking about this topic, so I'm not even. Okay. Oh, I skipped 15. Yeah, I also skipped 15 because, like, that's another topic that's not gonna be tested on. 16, yes. Hmm. What about 17? Okay. 18 is B. Yes. 19 is A. 20 is A. Yep. 21. A, B, C, and E. Good. 22. 23. 24. And I skipped 25 as well because this is something that we're not. Okay, so I did get a couple wrong, but also I feel like the ones I got wrong are also things that, like, my professor definitely did not really spend much time on. Some of them I probably should. I will be reviewing a bit more closely just to see what I got wrong. Okay, so now I'm going to move on. I'm going to do the remaining, like, 25 questions I have left because I do have more. I have 50 questions in total. Um, a nurse is caring for a child who exhibits signs of being physically abused. Which of the following actions is most appropriate for the nurse to take? So the options are ask the child to describe what happened in detail, take photograph of any visible injuries, report the suspicion of abuse to the proper authorities, or discuss the abuse with the parent to understand their perspective. It's a child. I feel like the questioning the child is not really going to yield much. You're not going to talk about the abuse with the parents, because especially if they're the abuser, you won't do that. That's just going to tip them off. I'm pretty sure you wouldn't be taking photos, so it's going to be like report the suspicions of abuse to proper authorities. Um, a nurse is working with a client who has been diagnosed with antisocial personality disorder, which is okay. Again, I'm gonna cross this out because it's really not on my test, and I'm not wasting time. A client with PTSD is experiencing flashbacks. Which of the following interventions should the nurse use to help the client ground themselves and manage the flashbacks? Okay, I feel like I'm doing a lot of talking. Encourage the client to focus on soothing mental images. Ask the client to describe the traumatic event in detail. Instruct the client to focus on their breathing and surrounding. Provide reassurance that the trauma is over and cannot hurt them anymore. Well, it's saying to what would help to ground the client, and that would be like doing the deep breathing and focusing on their surrounding, what is present, what is here and the now. A nurse is providing education to parents of a child diagnosed with ADHD. Which of the following recommendations is most appropriate to help the client focus in school? The first was give the child frequent breaks during homework. Is this focus in school? So that already is like no. Place the child in a quiet, distraction free area. Yes. Increase the amount of time allowed for completing assignments. No, that's enabling. Provide multiple distractions to keep the child engaged. No, that's gonna make them more distracted. So B. Which of the following are common symptoms of OCD in adults? Excessive cleanliness or hand washing, repeated checking behavior, compulsive need for symmetry and order, severe anxiety when rituals are not complete, extreme anger towards others. So these are actually all signs and symptoms. A nurse is planning care for a client who is diagnosed with a trauma and stressor related disorder following a natural disaster. Which of the following interventions would be most beneficial in reducing the client's distress? Encourage the client to talk about their trauma at length. No, we're never going to do that. If the client wants to talk about their trauma, that's fine, but we're not encouraging them to talk about it. Provide a calm, supportive environment with minimal stimuli. Instruct the client to avoid reminders of the trauma. No. Suggest that the client focus on positive memories before the disaster. Yeah, no. It's gonna be B. Oh, bless me. A child with oppositional defiant disorder often refuses to follow rules at school and engage in frequent arguments with teacher. Which of the following strategies would be most appropriate to implement in the classroom? Use punishment to discourage noncompliance. Implement a reward system for appropriate behavior. Isolate the child from peers to prevent disruption. Ignore the child's misbehavior to avoid confrontation. So it's going to be B. A nurse is caring for a client who has been diagnosed with intermittent explosive disorder. The client's family expresses concern about the client's aggressive outbursts. Which of the following response by the nurse is most appropriate? The client needs to be isolated from the family during episodes of aggression. IED is a result of poor parenting, so the family needs to change their approach. Definitely not. That's you're blaming the family. Anger management strategies can help reduce the frequency and intensity of outbursts. Okay. And medication is not recommended for treatment of IED, which is false. We do give meds, usually mood stabilizers or SSRIs. So I know that statement is false. I'm gonna go with let's see. A A nurse is assessing a 10-year-old child who has been diagnosed with conduct disorder. Which of the following behaviors would most likely be exhibited by this child? Consistent following rules? No. A strong sense of guilt for misbehaving? No. Destruction of property and stealing? Yes. A nurse is working with a child diagnosed with autism spectrum disorder. The child has difficulty understanding social cues. Which of the following intervention would be most helpful for improving social communication? Using clear, direct language and visual support, encouraging the child to avoid eye contact to reduce anxiety? No. Teach the child to mimic other children's behaviors? No. Instruct the child to follow rules without exception? No. So I'm going to go with A. A nurse is educating a client with OCD about exposure and response prevention therapy. Which of the following statement by the client indicates understanding of this therapy? I will be exposed to situations that trigger my obsession but will refrain from performing rituals. I will only be exposed to a situation that makes me feel comfortable. I will not need to change my rituals, only the way I think about them. I will learn to reduce my obsession through medication alone. So the answer is A. A nurse is caring for a client diagnosed with dissociative disorder. The client expresses feeling detached from their own body and describe watching themselves from the outside. Which of the following interventions should the nurse implement first? Encourage the client to explore past trauma, provide a safe environment to reduce sensory overload, ask the client to describe their feelings in detail, and administer anti-anxiety meds as prescribed. So I would say you want to provide a safe environment. A nurse is assessing a client with a history of violence. Which of the following behaviors indicate a potential for future violent outbursts? Select all that apply. Frequent verbal outbursts of anger, a history of physical aggression towards others, displaying remorse after aggressive episode, impulsive behavior and poor judgment, passive avoidance of confrontation. So A, B, D. A nurse is teaching a parent about strategies for managing a child with oppositional defiant disorder. Which of the following should the nurse include in the teaching? Select all that applies. Set clear and consistent expectations for behavior. Yes. Use reward and positive reinforcements for desired behavior. Yes. Avoid giving the child choices to prevent defiance. No, you want to give them choices because that will help with the defiance. Encourage the child to express feelings of anger in a healthy way. Use a timeout method as use timeout as a method for discipline. I want to say mm, E as well. Okay, got 10 more questions to go. And then after that, it's time to wrap it up and call it a night. Like, oh, tired. A nurse is caring for a client who has experienced sexual abuse. The nurse is preparing a discuss to discuss the incident with the client. Which of the following is the most important consideration? Ensure that the discussion takes place in a private, safe environment. Press the client to discuss every detail. Nope. Focus on the client's emotional reaction to the trauma. Encourage the client to forgive the perpetrator. So I'm going to say A. You want to make sure this is private, like, yeah, and safe, and the patient is comfortable. A nurse is caring for a child diagnosed with ADHD and is experiencing difficulty with self regulation in the classroom. Which of the following is the most appropriate classroom intervention? Allow the child to stand and move around the classroom. Provide the child with unlimited access to stimulating activities. Hell no. Implement a token economy system for positive behavior. Encourage the child to work alone with minimal interaction. Hold up. Oh, okay. I'm like stuck between two choices. So I know it's not A and it's not B. I want to go with C, but like I low key feel like it's D. Like, oh my gosh, it's like stressing me out. A nurse is caring for an adult client diagnosed with PTSD who's experiencing difficulty sleeping. Which of the following interventions should the nurse prioritize? Encourage the client to take naps during the day to reduce anxiety. Implement relaxation techniques before bedtime. Suggest that the client avoid discussing the trauma at all costs. Recommend the client use alcohol to sleep. So C and D are wrong 100%. You don't want to really take a lots of naps in the day. So it's going to be B. You want to do those relaxation techniques before bed because it's going to help you fall asleep. A nurse is caring for a 5-year-old diagnosed with reactive. Okay, again, this is not being tested, so I'm skipping it. A nurse is working with a child who has been diagnosed with separation anxiety disorder. The child refused to go to school and constantly fears being separated from their parents. Which of the following intervention would be most beneficial for this child? Gradually encourage separation through small steps. Allow the child to stay home from school until they feel comfortable. Nope. Reassure the child that their fears are irrational and unfounded. No, because how is that going to help keep the child home until they outgrow the fear? No, so we just want to do gradual, small baby steps. A nurse is providing education to a family about the management of conduct disorder in a child. Which of the following are key interventions that the family should implement? Select all that applies. Establish consistent rules and consequence. Yes. Provide rewards for positive behavior. Yes. Ignore aggressive. No. Use punishment. No. Encourage the child to interact with peers in structured setting. That's the key part. Structured setting, yes. A nurse is developing a care plan for a client diagnosed with a neurodevelopmental disorder. Which of the following interventions should the nurse prioritize? Promote independence and self sufficiency. Focus slowly on correcting deficits in cognitive abilities. Encourage the client to participate in group therapy. Ensure that the client has access to consistent, structured routine. I want to go with A. Okay. A nurse is caring for a child diagnosed with OCD. Which of the following strategies should the nurse use to help the child manage compulsion? Encourage the child to complete rituals as a way to cope with anxiety, help the child gradually reduce the time spent on ritual, discourage the child from acknowledging the need to perform ritual, allow the child to engage in the compulsions whenever they feel necessary. So it's B. You want to gradually reduce the time spent on them. Three more questions. Three more questions. And then check my answers and bedtime. Doesn't matter how I do, I'm going to my bed because I need sleep. And we're going to pray and ask God to help us tomorrow. A nurse is assessing a client with a history of childhood trauma. Which of the following findings would be most concerning in relation to the client's coping mechanism? Avoidance of trauma reminders, difficulty forming trusting relationships, chronic sleep disturbances, and or D, engaging in self-destructive behaviors. It would be D because like all the other ones are like okay, but like if you're being self-destructive as a coping mechanism to these things, that is very, very concerning because one, like a safety risk, like is this patient like the self-destructive behaviors can lead to suicide, like suicide, and that's always, always, always like safety, safety. Yeah. Um, a nurse educating the family of a child diagnosed with autism spectrum. How does it sound hoarse? A nurse is educating the family of a child diagnosed with autism spectrum disorder about behavioral interventions. Which of the following should the nurse include in the education? Use clear and simple language, encourage repetitive behaviors to promote comfort, implement a structured routine to reduce anxiety, reinforce positive behaviors immediately, allow the child to make independent decisions about their behavior. This is select all that applies, so we're going to go A, C, D, E I'm iffy on because it's make independent decision about their behavior. We always want to promote autonomy, but like, what if the behavior is destructive? Like, no. And last but not least, number 50. A nurse is caring for a client diagnosed with intermittent explosive disorder. Which of the following actions should the nurse take when managing an acute episode of aggression? Engage in a calm, assertive manner to set limits. Ignore the behavior. Nope, nope, nope. Immediately administer sedating. Nope. Meds. No. Encourage the client to express their anger verbally. I'm gonna say A. Like if it's acute, I don't think you want them to be like verbalizing it. Like they're already angry. Oh, wrong thing. Now time to check my answers. Okay. Once again, I'm going to use a different color as I am checking. So 26 is C. I skipped number 27. 28 is C, which I also got correct. 29 is correct. 30. Okay, 30, all of them except for E. So, which I picked all of them, but it said not E. 31 I got correct. 32 is correct. What did I put for 33? 33 is correct. Wow, look like I did better on the second round than the first round of questions, which is good. Yeah, okay, look at that, look at that. Yep, I'm getting these ones right, guys. Look at that. This is why I like doing practice questions, because you see, you read the rationale, you understand, and then I feel like when you go back and do other questions, it's like, okay, it makes sense. Yeah. 39, AB. Okay. Oh, yep, 39 is good. 40 is A. 41, yes. 42, yep. 43, I skipped 43. 44, yes. 45, A, B, and E. Yes, sir. 46. Ooh, I got 46 wrong. Oh, yeah, this one I was iffy on. I was between A and D, and it was D. Okay. But that was the one I was going back and forth. I'm like, okay, but now I know. This is for, yes. Okay, see, that made sense, because that's what I was going with. I'm like, am I thinking the wrong thing? Clearly, I was thinking the right thing. So, 47, got that right. 48 is correct. 49, ACD is what I put. ACD is the answer. Good. And then 50 was A. Yeah, I did so much better on the second set of like 25 than I did on the first set, which is really good. Um, I'm gonna probably look at the rationales a bit more and look at the questions again in the morning. It is 9:04. It's a bit earlier than I would go to my then I said I'll go to bed. I said I'll go try and start sleeping around 9:30. So with that, practice questions are done. I'm gonna run through my little cards I have here. And that's all I'm gonna do. And then I'm just gonna go to bed after that. So thank you guys for who was on, and I'll see you guys.